This is a report in the British Medical Journal that basically highlights a continuing trend, which is a good news story, that the number of people who have died from cardiovascular disease continues to decline, and this is a trend that we've seen thankfully over the last 30 or 40 years. So where we had a situation with high numbers of deaths in the 70s and 80s, there have been declines over that period of time, and we now have more people alive, and it's a good news story. So although this is a national study, it actually shows that the decline in mortality is actually best in Northern Ireland, but that's probably because we actually started off with a worse situation. So basically this has been brought about by a range of factors: improved surgical intervention, improved medicine, improved diagnostics. So in other words, people are being picked up with conditions earlier on and be able to treat it. And also then at the other end of the spectrum, all the work around preventative measures, so that people are much more aware of the issues and therefore taking action. And hopefully people are changing their diet, people are giving up smoking and moderating alcohol consumption. So all of this is hopefully, it's a range of factors that are leading to an improvement. Well, in chest, heart and stroke, we continue to sort of pressurise for a range of factors. Number one is that we're campaigning on the smoking issue, and we've seen smoking decline in Northern Ireland from sort of 40% in people who were smoking in the 1970s, and it's now down to 22%. Sadly, that's slightly behind the rest of the UK, and we need to keep campaigning on that. Also, we need people to improve their diet, and chest, heart and stroke are in schools thanks to the generosity of the public. We were able to have people go into schools to talk to kids about the need for physical activity, the need not to smoke, and the need to eat healthily. However, at the end of the day, a lot of this does come down to government, and there are other issues that need to be addressed. One of them is a condition called atrial fibrillation, and there's about 30,000 people in Northern Ireland that are known to have atrial fibrillation, and we need to make sure that those people are on the appropriate treatment and medication. And also we need to go out there and through the GP surgeries find more people who've got this condition and basically find them earlier and ensure they're treated, so that we can continue to push these mortality figures down. Yeah, I mean, there's a long way to go on diet. I think people have got the message. I think that's the other thing. It's only since the 1980s that people were aware of the connections between bad diet and high levels of cholesterol. So people have taken that on board. The number of people that are eating the five a day and fruit and veg is nowhere near as high as it should be. But and that's the thing that we need to keep campaigning on, and people need to take responsibility. At the end of the day, as I said, they're improving medication and they're improving surgical procedures. But the best thing people can do is give up smoking and have a healthier diet and take exercise. Well, this is our 70th year, and there's still huge numbers of health issues out there. We campaign across heart, stroke and chest issues, and we'll continue to campaign. It's great that this is a good news story, that the mortalities in heart disease have declined, but there are many other areas out there, and particularly in health inequalities. There are lots of areas in Northern Ireland, the less well-off areas, the health inequalities between the well-off and the less well-off are actually greater, and those are issues that Northern Ireland chest, heart and stroke will continue to raise the profile in the public, on the media, and of course up with the politicians at Stormont.